good afternoon, or even good evening. Uh, I'm Councillor Graham Bridgman. I'm Deputy Leader of West Berkshire Council. I am the Executive Portfolio Holder for Health and Wellbeing, and I chair the local Outbreak Engagement Board. Now, I'm supported this evening by Councillors Joe Stewart, who's Vice Chairman, and looking around the room, I think we're expecting Dominic Bowick. Well, we'll see in a moment. Lynn Doherty, Steve Masters, and Martha Vickers. We also have, or are expecting, Nigel Lynn, who is Chief Executive of the Council, Tracy Daskovich, who is the Director of Public Health for Berkshire West. We also have Matt Pearce and Andy Sharp from our People Directorate. And I see Katie Summers just joined us from CCG. And I think that's everyone in the room. I think, sorry, Sean, apologies, Sean Murphy as well from the Public Protection Partnership. And Gordon Oliver is clerking the meeting and Zoom host. And as you will know, we are streaming this live to YouTube. So as people arrive, they will arrive. Gordon, do we have any apologies other than those who are intending to attend, and if they, assuming that they turn up?
The only apology I have is from Martin Dunscombe.
Thank you indeed. And I spoke to Martin earlier today. He's just come back into work after getting over COVID. So, or whether he is over is another question. So watch this space on that one. So yeah, when we get on to the item on communications members, that is simply to note that Martin isn't here and his team will pick up anything we need to take forward on the comms plan. Gordon, no doubt you'll make notes and pass those on as we need to. So, members, we have minutes of the meeting of the 6th of December in the pack. I'm hoping that everyone has had a look at those. Are there any amendments anyone wants to propose? No, I'll propose those from the chair. Thank you, Councillor Dr. Second. All those in favour of agreeing them? Thank you very much. Right, that's all agreed. Let's move on. And to the extent it needs to happen, Gordon, please append my electronic signature. Declarations of interest. Does anyone have any interest they wish to declare? I'm assuming, Gordon, we haven't received any in advance of the meeting.
Correct.
Okay, let us then, having dealt with the formalities, let us get on to the meat of this meeting and turn to Matt for a situation report. Matt.
Okay, evening everyone. Just going to take you through where things are at the moment. I think you'll be familiar with what's being communicated in the news. I thought I'd just start with a national picture, just to give you an update. This is taken from the coronavirus dashboard on the government.uk website. So really just highlighting that exponential growth in cases. You can see on the right-hand side here how quickly the cases are rising nationally. I think there's a 91,000 cases that have been announced today. So seeing a lot of cases across the country at this moment in time, which is a result of the Omicron variant, which we all know now is looking to be significantly more transmissible than the Delta variant. In terms of the southeast, we're also seeing that picture again. So you can see to the far right-hand side that rapid increase in cases across the region. In terms of the percentage of cases that are Omicron across the country, it varies really from region to region. So in London, it's about 4 in 5 people now that are 4 or 5 cases, that are identified as Omicron. In the southeast, it's around 40 to 50%, and that's similar to what we're seeing in West Berkshire at this moment in time. And again, that's rapidly increasing, which we're likely to see similar to London over the coming days. I think the biggest question is how long does that exponential growth go on for, and at what point will it stop? So it's certainly an uncertainty, which we're waiting to see over time. This is slightly out of date, so I'm not going to spend long on this one, but just to really give you a sense of where we were a few days ago. Positivity is still remaining quite high, so about 1 in 10 people that go for a test or test are testing positive, and that was slightly coming down. testing is increasing, and we are seeing quite a significant amount of pressure on our testing site in UB Showbound and general PCR testing. And just to reassure people, they are looking to increase capacity across those PCR testing sites, and reviewing opening hours as well. So that's ongoing. At this moment in time, West Berkshire is around 557.9, which is the second lowest in Berkshire, but that's increased. I'll go on to that in a second. And cases per 100,000 around 165. So when you look at the number of cases per 7 days, we're around 884. The all age case rate was similar to the South East average at this time, but slightly lower than New England. And then if you look at the epidemiology of cases, so again, we're looking at the West Berkshire, South East and England, you can see that surge in the South East and England being grey, the orange being the South East, that really sudden climb. At this moment in time, West Berkshire wasn't mirroring that. But if you just have a look at the latest data today, you can now start to see this is West Berkshire's latest position, around 200 cases per day. And you can start to see we're now mirroring that trend in London. So again, we expect to see that continually climb over the coming days. And that represents a 21.7% increase in the 7-day case rate. And we're now standing at 730.1 per 100,000 all-age case rate. So again, with regards to the age range, again, you can see whilst a few weeks ago, it was mainly focusing on the younger age groups, we're now seeing those darker patches, those increased age rates at the rates across all those different ages. Still focused a lot within the 5 to 14-year-olds, but we're particularly seeing high rates between 35 and 50. So again, it's starting to affect a lot of ages. Not so much the old age group, which is really positive, but I suspect as we see those rapid rates increase, it will go on to affect a number of different age groups. So the hospital data, at the moment, it's really pleasing that the hospital data isn't mirroring those increasing case rates, although I need to obviously urge caution that we know that it's going to take some time for those rates to translate into admissions. And I think that's the challenge that we've got at this moment in time. I think it's highly likely that as more and more people get COVID, we will see inevitably a rise in our admissions and people with poor outcomes and sadly deaths. But at the moment, I think we just need to be cautious about reading into that hospital data, because those sudden rise in rates that we're seeing, that's not going to reflect for a few weeks yet. I know I always get asked this question at this board, so I thought I'd preempt it with Chris Whitty's slide, which he showed last week. So again, we just need to be cautious about reading into this, because it does say quite clearly we shouldn't use this information to assess the effectiveness of vaccines. But really what this graph does show is in terms of the rates per 100,000 age ranges and the number of cases presenting to emergency care within 28 days of a positive test. So the orange bars just showing those vaccinated with 2 doses, and the black, those unvaccinated. And you can see as you go up the age ranges, the majority of those in emergency care tend to be unvaccinated. So again, it's just a really key message that the vaccination is really important, and I'm sure we'll cover that throughout the rest of the session this evening. And then a quick look into deaths. Over the last week, there weren't any deaths reported, but we've had 278 COVID-related deaths since the start of the pandemic. With the exception of week commencing the 12th of November, we were actually statistically significantly higher than what we would have seen for that month compared to the previous 5 years. But in general, we are in line with what we'd see for this time of year. And you can see those blue bars just representing, sadly, the number of people that die and have a diagnosis of COVID within 28 days of them dying. I just wanted to do one slide on community testing, because I know we've received lots of inquiries from the public on this. So I think it's important. This is community testing in terms of lateral flow testing. So these are the devices that you can order online, go to a pharmacy, and are primarily used for asymptomatic testing. So many of our listeners will be aware that there's been a big policy shift to 7-day lateral flow testing, particularly for those people that are identified as contacts. But also encouraging people to take lateral flow testing if they go out to events or crowded areas. There has been some logistical issues with the online ordering system and delays to deliveries of pharmacies, and that led to short-term closures of online LFT home test kit portal. but this is now being reopened to the public, and that was largely as a result of huge demand as a result of this policy change. We're hoping that that is slowly starting to improve, but I suspect there will be a few issues over the coming days as logistically they adjust to ensure that there's sufficient testing in the system. In terms of what we've done locally to address this, so we've done lots of communication to residents to suggest that this is a temporary logistical issue rather than a supply issue, and we've been assured by government there's plenty of test kits around. And in response to the temporary policy change, what we've done is extended our community testing offer to more residents. So whilst it's primarily focused on targeted testing for those most vulnerable or exposed, we're now making it more widely available. So as a result of this, we've increased the number of testing crews. We're offering a new static site at the Kennet Centre in the shopping centre so people can go and get their testing kits. And we're also doing testing as part of the Hungerford vaccine clinic. And we've also ordered a quite significant number of LF2 testing kits going forward. So in the past week, we've distributed about 8,500 home test kits, including 2,100 at Hungerford and 5,000 at the Kennet Centre. So just a quick final update for Omicron, really, for me. My last slide, I think, in summary, is that there's lots of unknowns, but we certainly know that Omicron is now the dominant variant in the UK. We know the doubling time is fast, it's 2 to 3 days. There are strong indications that Omicron is immune evasive and very transmissible. And I think the key thing for me is that actually there's limited evidence on whether Omicron is less severe. We really don't know at this moment in time. So over the coming weeks, we'll certainly know more about it. But at the moment, there's no evidence to suggest it's any less severe. We know that people are 5 times more likely to be infected with Omicron than Delta. However, and I think it's really important again, and some of you would have seen in the news today, that vaccines are expected to protect against severe illness, hospitalizations, and deaths due to infection with Omicron, and as much as 85% protection. So that is really strong protection. Vaccines prior to that offering anything between 95% protection and above. 85% is really good. So it's really important to get that booster, or if you haven't been vaccinated at all, really important to go and get that jab now. However, saying that, even no vaccine is 100% foolproof, and we will see something called breakthrough infections. So where people have been fully vaccinated, they will get infected, and that's why it's really important to take a whole range of different measures to protect ourselves. And as I said, significant numbers of people infected with typo there will likely to lead to an increase in hospitalizations and deaths. And last but not least, everything we've been saying for the last few months and years, testing, vaccinations, and for want of a better word, non-pharmaceutical interventions remain critical. What I mean by that is hand washing, wearing face coverings, and just being sensible and taking necessary precautions, particularly over the winter months. That's all from me. Thanks, Cam.
Thanks. I guess my reflection is and thank you for sharing that data, the national data on vaccination as opposed to hospitalization and age ranges. That the fundamental question for me is how ill people are getting with this, even if they are vaccinated, and the extent to which people are being hospitalized, even if they are vaccinated, and judging that against the age ranges, because obviously in the early days of the pandemic, it became apparent that children, whilst they might get COVID, weren't getting anywhere near as ill as those at the upper end of the age ranges. And I just guess the discussion point is, to what extent we will ever be able to live with COVID as a continuum, something that we have to be vaccinated against on a regular, with boosters on a regular basis, and how long this whole saga is going to continue, whether we will ever be in a position where we don't have hospitalizations out of as a result of COVID, and whether we will ever be in that position where society has managed to get enough people vaccinated to stem the tide. I guess that's just a reflective from me. I don't know whether you want to say anything, and then I'll come to Katie, Councillor Masters.
Yeah, there's lots of unknowns to that question, Councillor Bridgman. I recognise that people are getting tired now and you know, it's been a long journey, hasn't it, to get to this point? And obviously it's Christmas time as well, which is proving quite difficult, and I think that will influence how people behave. I think we're still obviously trying to reach as many people as we can. There's still lots of people that haven't been vaccinated, so whilst vaccination does provide a lot of protection, still a lot of people in the country that haven't been vaccinated, and that will inevitably lead to pressure on hospitals if they were to get COVID. So there will come to a point where I think there'll be regular boosters. You know, I don't think we're at that point yet, but we will have to learn to live with it. In the longer term, we hope that, you know, COVID will be less severe, but that takes many years for a virus to kind of become less severe. So I don't really have a clear answer. But
No,
I certainly think winter's
I wasn't expecting an answer, Matt.
No, I know you won't. I'll try my best.
Katie.
Yeah, 2 questions, Chair. The first one is, for the vaccination programme, we know that we cannot offer a vaccination now to anybody who has been tested positive for 28 days. It'd be really helpful, I think, if we could get regular updates from local authority areas about the number of people that are testing positive at 28 days, because we can run that in through our vaccination numbers to have a clear understanding about what that demand is. Is that possible, Matt?
Well, yeah, I think we could probably do that. Katie, I don't see a problem with that.
Given the fact that actually the rates are increasing, it will be really helpful for us. The second query I have is that I have recently gone along to get some lateral flow tests myself, and I note that the ones I received were very different than previously. These were just nasal ones as opposed from nasal and throat. I'm wondering whether or not, obviously I'm an informed person, but I think that some members of the public might get quite concerned about why they're getting different types of lateral flow tests going forward. What communication is going out regarding those differences of when they pick up a lateral flow test in the pharmacy, if this hasn't already been asked?
Yeah, I mean, I'm happy to pick that, Katie. We do lots of correspondence with the public. Obviously, we do our targeted community testing, which is assisted testing as well, so it can obviously help and show people how to do it. What we can do is work with our pharmacists just to make sure they are communicating with the public as they hand it out, perhaps to inform them. It is quite a hefty leaflet that the public gets, so I do appreciate the messages can be lost about how they do it, but that's certainly something we can take away and make sure we can help the public understand how to use each test, because they do differ, like you say.
And perhaps something that's, Gordon, something to stick on the comms list that, you know, clearly, as I think I said last time, I'm still in the old school. I've still got the old tests, so I haven't yet had any of the nasal only test. But, you know, I think I'll be able to work it out, but maybe just putting out a message would help. Councillor Masters.
Thank you, Chairman. Thank you, Matt, for the update. I think to speak for everybody, how impressed I've been, and I know Councillor Doherty was at Hungerford at the weekend, supporting the efforts there. I was wondering what plans are there to do similar mass community test vaccination locations, you know, such as that we did in Hungerford, in places like Thatcham, maybe, to bolster the numbers. And also, secondly, the Health on the Move, teams that have been going out and doing the hard to reach and the more isolated members of our community. There's obviously, quite rightly, the capacity has been taken, to bolster bolster the wider vaccination booster program. Is there any backfilling coming along online to ensure that those communities that were being targeted and have now had to, unfortunately, not have the same level of focus? Is there anything coming in the background to ensure that they no longer, they don't continue to be isolated and and missed the very premise of why we were doing the Health on the Move, for example. What's happening there to catch those in this, very urgent need to get boosted.
Councillor Masters, I'll let Matt come back on those. I'll come back to you in a moment. I think some of that will be for Katie and Joe. So let's park some of that for the vaccination update. Sorry, I think I interrupted you, and then we'll see what Matt has to say, and then we'll go to the others, and then we'll get onto the vaccination piece.
No worries. All right. Thanks. I'll leave it with that.
I think we'd probably just suggest for Katie and Joe to give their update. Councillor Masters, I think they covered lots of your questions then, if that's okay.
Councillor Bow. Sorry, Councillor Masters, I apologise. I thought you'd finished, but carry on.
And finally, just a bit of clarification, because I know I've exchanged messages with Matt about some of the testing where people have, in the past, they've been in families where people have had positive tests, and then they've come up negative, and there's been some concern there. Are we absolutely confident that the lateral flow tests are capturing the new Omicron variant? And is there any concerns on the national testing scheme that we are missing? Because a number of people have got in touch with me who, as I've exchanged with Matt privately, that they're in the same household as people who have tested positive on the full testing, not just the lateral flow, and they're coming up negative, and it just seemed they're a bit concerned that they may be being missed, or there's some false negatives. Is there any background or incidents where this is occurring more often?
So 2 questions there. So I did follow up that inquiry with the national team and the regional team, and we did some data analysis to see whether there's any potential increase in false negatives across the district, and we didn't find any, certainly not compared to what happened with the Mensa lab. So I'll follow that up again, but they're certainly not seeing anything in the data with regards to that. In terms of your second point about the accuracy of lateral flow tests, I understand that the UK Health Security Agency completed their analysis possibly at the end of last week, and they're saying that lateral flow devices are equally as effective in identifying COVID, i.e. the Omicron variant, as they were with the Delta variant. So I think that's reassuring, and just to advocate that people should continue to use LFT based on that.
And finally, just on that, would you recommend that they still self-isolate if they're in a household where they've not tested, or what's the policy and recommendations?
No, so at the moment, the national government guidance remains the same. I think people are probably more likely to get Omicron if they are in a household with somebody with COVID. But what they're saying is, obviously, they're recommending those close contacts to do daily LFT testing, and they're saying that is a really good way of picking up the virus early if they did get it. So at the moment, household members, providing they've had vaccination, they're fully vaccinated, they can continue. They should do lateral flow devices, and I'd just be extra cautious if you have got somebody in your household that does have COVID.
Thank you, Chairman.
Thanks both. Councillor Bow.
Thank you, Chairman. Thank you for the update, Matt. On the point about LFD kit availability, I placed an order with online today, and order was accepted, and delivery will be in 3 days' time. So slightly longer lead time for delivery, but looks as though things are moving faster now.
Thank you for that. Councillor Vickers.
So can I just say, Matt, I can't hear you very clearly. I don't know whether it's just me, but you're coming over quite muffled to me. I know my hearing isn't of the best, but I don't know whether that's a problem with anybody else. So I'm not picking up very clearly. But I think mine was going to be a very simple question, but I think it's been answered about. So the new guidelines is that instead of self-isolating, one just does 7 days of lateral flow to confirm that you haven't picked up an infection if you in contact with somebody with COVID. So the self-isolation is not necessary as long as you're testing daily. Is that right?
That's correct. Sorry about my mic. That's correct. Providing that they're fully vaccinated, and they can, as a close contact, do daily lateral flow testing.
Fully vaccinated meaning having had your booster, everything. Okay. Thank you.
And maybe if that message isn't getting out as clearly as it might be, it's something else to add to the comms list, Gordon. Councillor Doherty.
Thanks, Matt. Matt, we had our last LOEB about 2 weeks ago when Omicron had just sort of come out, and we said data within 2 to 3 weeks. So I'm taking it another week, and we should start to have sort of more conclusive data on the impact of Omicron. Am I right on my timescales on that?
Yeah, I think you are. I've changed my mic now, so hopefully that's better for everyone, is it? Yeah, right. Okay. Well, thanks for Nigel for identifying that. Yeah, that's right, Councillor Doherty. So I think London's going to be a good marker because they've obviously got 80% of their cases is Omicron. I think next week we'll probably start to see what those hospital admissions might look like. Certainly for West Berkshire, it's probably a little bit of a lag because I think we're slightly behind in the proportion of our cases that have Omicron.
Okay, and I know that we reckon about 50% of the over 18 populations now have the booster jab, but the boost, well, am I right in thinking your data graph, which you use with regards to hospitalisation, vaccinated versus non-vaccinated, is just double vaccinated as opposed to double vaccinated plus booster?
Correct. Yeah, no, that's a really good observation. So that was data. That was just data, and I think that was probably with regards to Delta rather than Omicron. But we suspect the same will apply, and that was based on people having 2 doses rather than the 2 doses and a booster. I think we're going to have to think about the terminology, aren't we? And that's some of the challenge at the moment. Going back to Councillor Vickers' point about what counts as being fully vaccinated, because it's variable by age group as well, isn't it?
So the interesting one's going to be the double vaccinated plus booster hospitalisation cases, but we haven't got enough data yet to actually determine that.
No, that's right.
Okay.
I mean, certainly we're seeing that if you have a booster, you've got a lot more protection than those that are doubly vaccinated. That's hypothesis anyway, and I think over time we will start to see that data played out, and no doubt we'll get that coming through.
Okay, well, I'm sure we're going on to Joe, but I guess the key here again is around the booster vaccination programme.
And before I come to Joe, I would reflect that a number of meetings ago, we spoke about James Kent having asked for some data out of the hospitals, and clearly, in order to, I find it surprising that we're still having to get this message across that you need to be vaccinated. But if ever there was an indication as to the efficacy of vaccination and of boosted vaccination, it is the differential between those in hospital and those who are very ill in hospital, who are unvaccinated, and those who have been vaccinated, at least to some extent, if not fully. So, data is key in many public health messages, and I think it's doubly so here. So maybe those who can take that message away, I'm looking at Tracy, Katie, whoever else is in the room, please take it away and press whichever bit of the health system we need to press to get that data out to borders like this one, so that we can get that message across to the public if it is needed. And as I say, I'm surprised it is needed, but it looks that way. So thank you all. Let us move on. Joe, I believe you're picking up this particular cudgel, even though Katie's in the room. Carry on, Joe.
Katie's been really busy leading across Berkshire West, so we thought we'd give her a break, and I'll do the West Berkshire update today. So thank you, members, for having me back. A lot has changed since I was here a fortnight ago. So a summary of the changes in approach in our new accelerated booster programme. All over 18s can now book a booster dose for 3 months after their second. 12 to 15-year-olds are now able to book their second dose either via the NHS website or they can wait until their school is visited by the school age IMS team in January. There is a national aim now to offer a booster dose to all adults by the 31st of December. So what that means is we're working with system partners to match our supply and demand. So we're looking for new sites to come online to support booster delivery, as well as supporting our existing sites to increase their capacity and the numbers they're able to do day to day. And that means that we need to address a lot of workforce gaps. So a big thank you to everyone at West Berks who's responded to the call to redeploy for marshals, admins, whatever. It's really appreciated because there's a lot of resource that goes into the vaccination programme. A couple of local updates. So as Councillor Masters, you mentioned the Hungerford pop-up. That's been extended now, so we're running up until the end of Wednesday. We are in very early discussions about whether there is any scope to extend that further over the festive period, looking into the feasibility of workforce, given those workforce demands that I've outlined. And as soon as we're able to confirm either way, I'll make sure I let you know. So current eligibility that is being offered at Hungerford are first doses for 12 to 15s. They're not able to do the second doses there at the moment. 16 to 17-year-olds can get first or second doses, and above 18s can get their first, second or booster dose there. So at the end of yesterday, 5,335 vaccines had been delivered at Hungerford, which is about 2,000 more than we thought they would do in the entire run of 10 days. We had anticipated about 300 to 350 a day, and have seen numbers, given everything that's happened in the last fortnight, of around 650 to 700 a day. So quite a lot coming through a small site in a rural area, but all the volunteers are doing a fantastic job making it work and looking after the crowds. And that brings me on to say thank you to both Councillor Doherty and Councillor Vickers for showing up with the high vis. It's just really appreciated to know that we've got your support, and especially support on the ground is always helpful. So further on to the Health on the Move van, it was really unfortunate, disappointing that the decision had to be made to cancel the visits last week. I think given the news announcements and the demand that had been seen at a Health on the Move van location in Buckinghamshire, we had an assessment of the venues that had been lined up and felt it's just not safe to go ahead in terms of managing crowds and that number of potentially interested people coming to small community locations. And you're right, Councillor Masters, the whole point of that programme is to support those communities that might struggle to access a vaccine, with particular lens on inequalities. So we are working systematically to see how we can then plug that gap. I think there's potential for our local pharmacies to run some small pop-ups, and I think we need to review our walk-in availability as well to make sure that those people that might struggle to use the national booking system have walk-in opportunities. So work's still being done on that one. So in terms of the new and existing sites I mentioned, I've just popped a list up there, and I have included some neighbouring areas for those residents that are on the fringes of the district where they might be able to go and get their vaccine. So I hope that's useful. I know that A34 PCN are working at Strawberry Hill on Wednesday and Thursday. So if any residents have managed to book their appointment through the national booking system, you will see me doing some admin, and I promise to have a really tacky Christmas jumper on. And I know there's a good level of take-up of those sites. So just keep a lookout on the national booking system because more slots are being added all the time. So in summary, I can go further into data if you would like me to, but I wanted to highlight that 52% of over 12s in West Berkshire have had their booster. And for context, across England, that's 50.4, so we're better than England. We're doing better than our Wokingham and Reading partners. Wokingham are at 47.5% and Reading at 30.9%. But we're just slightly behind our colleagues over in South Oxfordshire. They're at 54.6%. So we're doing well, and I think we'll be making some really good progress over the next couple of weeks and few days. And before I conclude, I would just want to highlight the incredible effort of the Kennet Centre Pharmacy, who managed to do 10,000 vaccinations over the last 4 days, which is huge numbers. So big thank you to the pharmacy team and all the volunteers that are supporting that venue.
Thanks, Joe. I know certainly echo that last point. That's a phenomenal number. I guess my question about your chart is, given that not everyone over 12 is going to be able to get a booster, what percentage of those who are eligible for a booster have been boosted?
Yeah, that's always a tricky thing, because the denominator changes every day of those who are 3 months post their second dose. So I can get our regular update for you. Just a second, balancing between two screens. So this is the pack produced by my colleague in the CCG, Andrew Price, and he does do some work on establishing who is that eligible cohort. So at the date this data was extracted, so that was on the 17th, so Friday, 59.1% of those eligible had had a booster. So that meaning over 18 and 3 months post their second dose.
Fine, thanks. That assists. Councillor Doherty.
Thanks, Joe, for your presentation. I've got 3 questions, if I may. One question is, thank you for your thanks for volunteering. I feel it's the least I can do. However, I have been asked by members of the public about how they could potentially volunteer. And I noticed that you talk about workforce and capacity, yet there's a lot of very willing. We've seen our communities really respond so well over the last 2 years nearly. How could a member of the public offer to volunteer at a local site is one of my first questions, because I've actually specifically had that asked of me. So what is it we can be telling members of the public if they wish to volunteer at a vaccine site? Because I know that you're looking at the potential continuation of the Hungerford site. I'm there tomorrow, and I thought that was going to be the end of it, but it looks like it may roll on into the following week. So what is it, if you're a member of the public and you're sat at home watching, or we can help promote for you, you need to do if you want to volunteer at one of these sites in order to assist with the booster effort? So that's my first question. Do you want all 3, or shall I let you answer that one first?
I'll go on that one. So I would suggest that you sign up through the Royal Voluntary Service, and they've got a really good app that they're using if you are digitally inclined, which shows shifts available and locations and sort of roles that are seeking help. So that's certainly one way. And I know a lot of the practices will be potentially using that as well. At Hungerford, we do have a local system in place. We didn't have enough visibility of the RVS site because that had been set up by our colleagues in Oxford Health. And we had lots of support through the Town Council and through West Berkshire Council. So we do have a local rota in place. But I can share a link to the sign-up sheet for anybody who might be interested. But I would say in the main go through the Royal Voluntary Service.
Okay, I think
let me come in there and just say yet another piece for the comms. Joe, can you share that to the extent you need to, and anything else you want to share with Gordon that he can pass on to Martin? You know, these are all parts of the comms package we need to go forward. Sorry to interrupt.
Yeah, okay, that would be really useful. Thanks, Joe. The second question is, I've had a letter through today with regards to the launch of the Protect and Vaccinate scheme for rough sleepers. So I know it's only come through today, and there's funding to follow, sort of 28 million. I'm just wondering, I know in the initial round that we went out to and worked with our voluntary partners on making sure we got that out there, and just, is it on the radar, and how are we doing the boosters? You may not know yet, because I know that we've just had the funding and confirmation through today, but to tell me that the rough sleepers are on our radar.
Definitely. A brilliant team from Thatcher Medical Practice on the 9th of December went to the soup kitchen in the evening and vaccinated about 25 people there that were service users. A lot that I spoke to had already walked into the Kennet Centre as well, which was really good to hear. And we then took the Health on the Move van before its unfortunate cancellation on the 13th of December to Two Saints, and did about 25 there as well. So certainly ensuring that our rough sleepers and that vulnerable community get their boosters is really important. And I'll be talking to the housing strategy manager just to audit what are the numbers that still need to be boosted, how can we get them access, what more support we can provide. So that's definitely really a priority.
Thanks, Jo. And finally, I just wanted to thank the A34 PCNs, because my daughter's booked in at the clinic on Wednesday, I think it is. So watch out for her, Jo. But really easy booking system through the national booking scheme. And it's really good to see our local PCNs doing it now, so that people can stay locally and not have to travel. So just a huge thanks to our local A34 PCNs for joining in that vaccination programme.
Thanks both. Councillor Vickers.
Thank you, Liz. I just wanted to add my thanks to Jo for all the hard work she's done in getting the clinic up and running. And I was very impressed by the Hungerford one. I mean, it's such a positive atmosphere, despite the long waits that people had. And some of them waited a really long time. The morale was so good. They were saying thank you to all the volunteers. They were amazing. And the coordination and getting those with disabilities to the top of the queue, mothers with children, etc. Didn't see many pregnant women there, but maybe that was the time of day I was there, which is still an anxiety. Are women coming forward who are pregnant? Are they getting vaccinated? So thank you for that. And there seem to be masses of volunteers, but if you're extending the clinics, then obviously you're going to, I'm sure you will need more. So that information will be good. And again, I'm so impressed by the Kennet Centre, who are trying to do walk-ins when they can. So they're mainly appointments, but if people turn up, they will squeeze in walk-ins. So yeah, which I think, as you said, is very important. And getting to the vulnerable community is so crucial. So it is a shame that some of those vans had to be withdrawn that get out to the communities that aren't really accessing their vaccine. So it's good to see that that's being addressed. So thank you.
Thank you for that. And Councillor Masters.
Thank you, Chairman. Thank you, Jo, for the update. It's not particularly anything direct to Jo, but maybe to Councillor Doherty. I know there was some discussion in the media about the volunteers and car parking, and I know there's been some coming and going. Councillor Doherty, can you just clarify what the position is and what people, so we don't discourage people too much, how they can, what the process is for claiming back, or what mitigation there has been for the car parking?
I can, in order to get the booster through, West Berkshire Council has offered the Newbury Station car park opposite the Kennet Centre to enable volunteers to park in. However, on an ongoing basis, all volunteers are entitled to claim back through the voluntary service that they're working for, their own expenses. So the programme covers all volunteer expenses. I think it's up to £10 a day parking is included within that. But at the moment, because we recognise the huge amount of work to get the booster through, and we want to encourage as many people as possible, and we're able to, we're offering and have been offering from the moment we were asked the station car park opposite the Kennet Centre.
Thank you for that clarification.
Councillor Stewart.
Thank you. So, Jo, you'll know that, bearing in mind I'm the east of the district, all three of my vaccinations, so my first and second and my booster, have been done at the Triangle Pharmacy in Tilehurst, who've been absolutely amazing and really well organised for such a small area. They literally divided their pharmacy in half so that they still have a sort of a business operation on one side and then the vaccination centre on the other. It was a question about data, really. So where do I pop up in your data, bearing in mind that I'm a West Berkshire resident, but I'm having my jab in what is effectively a pharmacy that is not West Berkshire, it's under Reading?
Yeah, so your vaccine record is linked to where you live rather than where you were vaccinated. So when we're looking at our patient records, so data mined from patient records, all that's coming round through from the government dashboard, it is referring to your address rather than the location your vaccine was conducted in. So that means that if there are families away for Christmas that haven't been able to get their booster while they've been at home and they're going away for a week to see family or whatever, then you can get your booster at a site that's convenient for you, but it will still be updating on your records and we'll still know that you've got your vaccine, so we can monitor levels of take-up for West Berkshire residents.
Okay, brilliant. Thank you. I had a couple of residents ask that when they see the data, so I'll be able to confirm. Thank you.
Joe, before I bring in the other two more questions, on that point, I know that when we were originally discussing, particularly in relation to the racecourse, there was an issue about the west of Reading, where the rest of Reading villages data, PCN data, landed, if at all, in the system. Has that been resolved?
I'm not sure what issue you're referring to.
Well, I recall that the West of Reading, the three PCNs that were operating out of the racecourse were showing up on some of the data that you were disclosing to us, and we were discussing about the numbers of people within West Berkshire, and you were saying that the West of Reading villages, particularly those who were being vaccinated out of the boathouse surgery in Pangbourne, weren't landing on some of those data sets because of the systems that were being used. I just wonder whether that's still an issue, if it ever was, or whether that data from the answer you've just given, Councillor Stewart, is coming together.
Yeah, that's not an issue, as they're using the Pinnacle system like practice sites. It's all feeding through to the National Immunisation and Vaccination Management Service. So patient records are being updated and it's feeding into the national dashboards and our EMIS searches as well. So everything is linking up.
Yeah, so my jab deliberately in Lambourne, that's almost as far away from my home address I could get within West Berkshire to get a jab, deliberately, obviously, because we wanted to publicise it. It will show up in your data in the right place.
Absolutely.
Nigel, over to you.
Yes, coming back to Councillor Vickers' question about homelessness, I've been in touch with the Housing Services Manager today, as it happens, asking that same question. And the data I've received is that 20 homeless households out of 48 in our emergency hostels that we're aware of have been vaccinated. So that's the data as of today. Thank you.
Thanks, Nigel. Katie.
Yeah, so just to follow up on what Joe was actually saying, is that the other updates to sort of give is we've had a slight change last week in the fact that now nobody has to wait for 15 minutes after they've actually had their actual boosters or vaccinations, any first, second or boosters. So we do think that literally as of this week, we are going to hugely, massively pick up the amounts of people that can go through and be boosted. So I'd expect when this group comes together again, you're going to see a completely different picture from West Berkshire of the number of people that have been vaccinated or had their boosters. So it's worth noting that at this local outbreak engagement board. Equally to note, obviously we're in the Christmas season here. And so anybody who might be travelling to visit friends far afield, if they choose to actually have their boosters or vaccinations at another site, then that would still be recorded on your GP system. So it will still be recorded as you've had your booster. So it will be still here in West Berkshire, just for clarity. And then finally, I'd like to note here, and I think it's already been mentioned, the team, the collaboration that has gone in to support the Hungerford cricket field site has just been amazing. It's a joint approach done by both the NHS as well as councillors, as well as the council, as well as the voluntary sector. You're making a huge, huge difference here, and it's a big thank you. And I've heard nothing but positivities from local people who've taken forward. Some people have moaned about the waits, but I think people are still waiting 3 hours sometimes to get vaccinated. So it's a big thank you.
Thank you, Katie. And back to you again, Councillor Masters.
Yeah, apologies. Just to 2 points. Is there any plans to I think I mentioned in my raft of questions at the beginning about doing a similar thing, maybe in Fatcham or somewhere towards the, further towards the east?
So on that piece, Tracy and I received a letter last week regarding what are we doing, how we've got to prioritise opportunities for those hesitant to come forward for their boosters. The first priority, as set out from the letter from the national team, was try and ensure you've got as many normal NHS sites set up as clearly as possible. First priority. Second priority is about the actual communication, which sounds like Gordon is on it, to make sure we really get the clear message about take up the opportunity to be boosted. And the third priority is about then organising other opportunities to do pop-ups. Tracy and I are working on this at the moment and actually making sure that we're modelling out about whether or not what areas that we feel might necessarily need to have pop-ups to put into place. But I expect those pop-ups will start to actually come in place probably early next year.
Thank you, Katie. Also, we have a number of Afghan refugees and their families in the area. Are they being looked after, and and is their vaccine status being monitored?
Yeah, so the one thing that Andy Sharp and I were talking about is we're trying to organise for some of the GP clinical leads to go in to your 3 hotel sites, because for some reason in West Berkshire you've got 3, and actually vaccinate your Afghan and also asylum seeker communities. So again, that's something we're actively working on this week to get that supported, and so everybody has the opportunity.
Okay, and thank you very much, Katie, for that. Chairman, I have a couple of questions about care home status and stuff. When would I be best placed to?
Well, I was actually going to raise that myself in any event. So let me ask my question. Then if I haven't asked yours, Councillor Masters, you can ask it as well. And then let's see who wants to answer it.
Okay.
The question I have, which I wanted to wrap up, I just wanted to see how the discussion went, is what we know about, and Andy Sharp's in the room as well, vaccinations, in particular booster vaccinations. And I guess before I go on to this, my reflection on some of the questions we've just had, to some extent, I'm surprised that we need to persuade people to get their boosters. If we managed to persuade them to get the first and second jabs, I would have thought that they would be relatively keen to continue that process and get their boosters. But please correct me if I've missed something there. The differential between care staff and care home residents and the NHS staff, and take up of vaccination, take up of boosters, and how we're rolling that programme out in relation to care homes and care staff. I open the floor to who wants to pick that one up.
I think it's going to be
don't
me.
All speak at once.
I think it's going to be me and Andy who pick this up. Andy, do you want to go first?
Yeah, if that's all right, Katie, thank you. So all care homes have been visited as part of the programme. So there's been an offer made. Strong take-up across residents. There is a slower take-up than we might like for staff working in care homes. So we're approaching 40% of staff that have had their boosters in care homes in West Berkshire. We've provided details to Katie and her colleagues of the homes where we've got particular low take-up, with a view to arranging a further visit to those homes to try and boost the numbers of people taking the booster. We've also communicated to all care homes across West Berkshire last week to encourage take-up as well. The data we get is from the capacity tracker, which does have time lag to it. So the data I've just given you has a big caveat next to it, and it does tend to move around. So about a week and a half ago, the figures were 10% lower than they are now. So things do move relatively quickly. So hopefully by the time we get to the end of this calendar month, things will have changed significantly.
I guess my reflection on that, Andy, is the question of the requirement for care home staff to be vaccinated for their employment status, and how that's reflected, and where where that is going.
Yeah, so the legislation at the moment is doses 1 and 2. So all care home staff must be vaccinated dose 1 and 2. They're not eligible to work if they haven't had those first 2 doses. But there's no current legal requirement to have the booster. I'm sure that will change in time, but at the moment that isn't part of the legislation.
Thanks. Councillor Masters.
Thank you. Thank you for that, Andy. Yeah, I was going to ask similar questions, but I also have a couple of other points. Bearing in mind that the numbers of boosters is not necessarily as high as in the staff, are we seeing cases in staff impact attendance and in terms of sickness, and what sort of level are we at in terms of percentages of staff with COVID, etc., and what contingencies do you have in place should that become critical? And are you working? I'm imagining you are working with public health and the CCG on this, to try and build in some kind of resilience. Where are we with that? Can you reassure us?
So we don't track data for the positivity rates in the external market, but we do have close relationships with those providers, and we've not been alerted to any providers who have significant issues around staffing gaps at the moment as a result of COVID, although that is a concern going forward as rates increase. In terms of our own internal provision, we've had 1 or 2 cases of COVID amongst staff. We've worked with public health to manage those situations to ensure that residents and other staff are protected through that process. But obviously we also, like all providers for our own homes and in the external market, we use agency staff if there are gaps in provision. And at the moment, the market is okay in terms of staff, but it is something, as I say, we're concerned about going forward. There are risk plans and contingency plans in place if we do have capacity problems. And we expect that of external providers as well, and we work closely with those providers to make sure that they have those plans in place.
Thank you. And just finally, Chairman, if you'll indulge me, in terms of patients in the NHS, there are obviously there's concerns about capacity of the NHS to cope, and in terms of getting people home if they're vulnerable, and maybe can be taken care of at home. Is the domiciliary care and home care provision, is that holding up through the same methods? And also from Katie on the CCG, what's the status of the of beds and capacity in that front looking like?
If I covered on care first and let Katie pick up on the NHS situation. So we are seeing pressure in the domiciliary care market. We have a higher number of hours waiting to be commissioned at the moment than we would like. The domiciliary care market is under pressure for quite some time with workforce challenges, and that is being hit as a result of COVID at the moment. Again, we work with providers to try and manage their capacity and to ensure that people aren't waiting for too long. But that is probably a greater concern for us at the moment than the residential care market.
On the NHS market, NHS staffing, at the moment, the Royal Berks is at 72% of those people who've actually had workforce have actually had boosters, although I expect that's gone up today because they've just run an actual staff vaccination site literally today at the Royal Berks. On the actual issues of those people that are testing positive COVID, it's exactly like Andy was saying. I think actually there is a growing concern about staff who are actually being affected by COVID. What we do know though is if we don't get staff, if we don't get the public to take up this opportunities to have boosters, especially before the end of the year, it is going to potentially have an impact probably by mid-January. And that's where we probably see in the NHS a lot of people having to socially isolate because they're testing positive.
Thank you both.
Yeah, and thank you everyone for that, because I think we have really gone into some depth with those issues, and Gordon, we've picked up various things we want to get out into the public domain. So thank you all. Let us move on. We now come to PPP and Sean for an update. over to Sean.
Thank you, Chair. As Martin is not here, I'll say it for him. I'm conscious of time, so I will whip through my 2 slides, if I may. Okay, can we see that? Yeah. Okay, so just 2 slides, Chair, if I may. So just to give you a bit of a feel for where we are in terms of the service. So the data now with local contact tracing slightly lags as it does with the EPI data that Matt presented earlier on. So for the last 2 full recorded weeks, on the week ending the 1st of December, we dealt with 201 cases in terms of local tracing. And then on the week ending the 8th of December, we dealt with 223. Those numbers are still rising, and they're still rising fairly quickly, as you can imagine, as the overall case numbers rise in the district. So by way of an example, at the moment, basically in terms of 5 o'clock this afternoon, when I started looking at this, we still had another 118 had just come through further for sorting and allocation, basically within the service. So the numbers are fairly high, and we are basically looking at redeployment of staff from other areas in the service to actually deal with that, and alongside basically 1 or 2 colleagues from the public health team. Over the last 2 weeks, in terms of self-isolation and hub calls, we've actually spoken directly to around about 450 residents. And of those, we've actually provided or sorted out practical assistance to 20 of them. So some of that related to the provision of food, and some of it related to other provisions such as clothing. We are increasing the dedicated response, as I say, basically for local dedicated resource for local contact tracing, as I say, by reprioritisation. And our plan is basically as soon as we can in the new year, we're looking to get more staff trained across the authority, basically, so they are able to step in when we get these, if we get any of these kind of further peaks that we're going through at the moment. We've agreed a new prioritisation model with the NHS test and trace system, and that has been notified to them, and that will hold over the Christmas period. Going forward, basically during the Christmas period, the service is provided between the 25th and the 28th by the national system, so there will be no local contact tracing system during those dates. However, the outbreak monitoring and notifications from high risk settings will cover all across the Christmas period, basically will be monitored. And we have identified across the authority a number of subject area leads, basically should anything actually occur within the settings and the identified high risk groups. The local contact tracing will return again on the 29th of December, as will the isolation calls, and that will be covered all over the New Year period as well. So that will apply basically New Year's Eve, New Year's Day, and so forth, and that weekend and the bank holiday weekend. And finally, basically in relation to this kind of area of work, the coincidence reporting is still being considered on a kind of daily basis, and we are in contact with a number of settings where there have been potential outbreaks. So just moving on to kind of compliance work, I suppose, for want of a better word, and I suppose where we are is Plan B. So we are still carrying out some advisory visits to premises, and they are very much based on risk. So we're looking at premises with high volumes of people, and carrying out some visits to those, and actually in discussions with management of those premises around managing risk. We are working with businesses and premises that are affected by, or possibly affected by the certification rules that came in. And a good example of that would be Newbury Racecourse. So we in fact met with the racecourse basically as soon as the rules and the guidance were available. We have agreed with them some protocols around the management of that. And in fact, there was a meeting at Newbury Racecourse actually on the first day that the rules took effect, so last Wednesday, and we did attend that basically. So we're using that visit to basically provide some feedback. And obviously we're getting ready now. So there is the next plan meeting, I think it's on the 29th of December, which is a bigger meeting at the racecourse. So, but we have worked with them all the way through. We have gone through all of the risk assessments, and we're kind of satisfied that everything really is in place there that needs to be. we're also receiving questions from other premises about sort of events and things like this that had been planned, because the regulations actually are a bit more complicated than perhaps the kind of headline figures or the headline sort of story in the media, because there are a number of scenarios. It's not just nightclubs and venues with over 4,000 people or indoor venues with over 500 where it applies to. If it applies to venues, for example, with dance floors that go on beyond a certain time, even though they're not a nightclub. So and certainly to events of over 500 indoors. So in terms of events, just generally, the pre-Christmas event season is largely over. We did attend basically a number of these, and we certainly have provided advice on all of them where advice was sought from us. And just by way of a kind of headline figure, across the PPP area, since the 1st of April, we've actually looked at around about or sort of nearly 300 event plans, risk assessments, and provided advice. And I suppose the last thing to say is, Chair, I mean, we've seen no announcement today, but we are ready and we have got staff identified to deal with any change in legislation or guidance over the holiday period. So that's my update, Chair. Thank you.
Thank you, Sean. Yes, we live in interesting times, I think. Councillor Masters.
Thank you, Chairman. Thank you, Sean. I don't know whether you cover this, but I know we've not spoken about schools. You know, we've broken up for Christmas, but as cases multiply, what additional protections and have been put in play and have been planned moving forward? Probably Andy is probably as good a place as anybody to answer this for the return in January of children to schools. I know many parents are concerned about this, and as we saw on the heat graph from Matt's presentation, the amounts of cases is almost universal right up to care home age. So there's transmission across the whole of the population now, pretty much universally. So what's been done to protect the wider community through the transmission that's obviously going to happen in the schools come the new year?
Chair, can I suggest that, Andy, do you want to pick up the issue around schools? What I would say about schools stuff, Councillor Masters, is that obviously prior to the sort of end of term, a significant proportion of the cases we were getting notified through, particularly in I suppose what we would regard as kind of notifiable settings, were from schools, as you can imagine. So obviously that has now started to fall away. What I would say, just from a coordination point within the council, we have an internal coordination cell, and that is still planning to meet next week, in fact on the 29th, and we'll still keep under review any new guidance that comes in over the Christmas and New Year period. I'm not aware of any at the moment for schools, Andy, but maybe that's one you could pick up.
Yeah, thank you, Sean. So we continue to work closely with the schools, obviously, to make sure they have all the latest advice and guidance around how to manage any issues with COVID. There are testing regimes in place within the schools. There's also programs to try and support access to vaccine, and we've been working very closely with our colleagues in the NHS to make sure that those eligible for vaccine are able to access it as appropriate. That remains one of the best protections. Schools obviously are allowed to make some decisions around the use of masks, etc., as well, to support the position within the school, and where there are outbreaks, they are able to move to remote learning. So they take steps where they need to, and we work to support them. We've got staff allocated to work with the schools in education to make sure they've got the right advice. Where there are outbreaks concerns, we work proactively to address them, and that links in with Sean's team as well. So it's very well coordinated, and we take on a case-by-case basis.
Councillor Beck.
Thank you.
Thank you, Chairman. Yeah, I was going to speak to first of all to Sean's presentation, but I'll just echo or reflect Andy's comments there about the advice that we give to schools. When I've been going around on my visits, which I'm very pleased to say I've been able to do more recently, visiting the schools, I hear great praise coming from schools in respect of the advice that the school improvements team has been giving them. That's the channel through which the process that Andy spoke about of interpreting guidance and regulations that come through from central government, channeling them out to schools. So I think we've done a fantastic job there, and it's widely recognised by schools. So Councillor Masters, never fear. If guidance changes, then it will be reinterpreted, interpreted, and communicated to schools in a relevant and kind of consumable fashion. And while I'm praising officers, I just want to turn to Sean's presentation. I heard on the news today on the BBC Radio 4 about an incident where last year a business was issued a fixed penalty notice for £1,000 for what seemed to be a questionable or marginal breach of social distancing guidance, and that surprised me, because my experience of the West Berkshire way is that what Sean and his team have been doing is guiding people, informing them if they've been in breach, and encouraging them to take the appropriate steps. And I just want to thank Sean and his team for the excellent work they've been doing right from the beginning of this pandemic.
Thank you. I will pass that on. Thank you very much.
Thanks both. Okay, that wraps that one up, I hope, and let's move on. Future meetings, agenda items, AOB. I'll come to AOB in a moment. Members, I am going to call a further outbreak engagement board for the 10th of January. I don't think we want to try to hold one on the 3rd. So let us hold in 3 weeks' time, see where we are, get some updates, see what the data is telling us, and take that forward. So please put 10th of January at 6 p.m. in your diaries. Gordon will do the necessary in due course. I jumped past comms update because Martin isn't here. If you have anything you specifically think should be picked up that we haven't discussed via the communications team, please send an email to Gordon, copy me in, and that can go over to Martin. But I think, Gordon, you've captured the various points that we want to bring out and push into any public comms for transmission on. And of course, Martin can watch this back at his leisure anyway, so he can see what everyone said. So is there any AOB? Please put your hand up if there is. If there isn't, and I see no hands, then I will say, Gordon says everyone email he's on leave, so everyone, if it hasn't been captured by Gordon, please send something to Martin to the comms team direct. There you go. Sean.
Yeah, can I just make one point on comms? And we talked about this earlier on. What I would do is to urge residents where they can to complete the online journey for tracing, because obviously that then reduces the number of calls that have to be made either by the national system or by the local system. So that is a comms message. We did discuss it earlier. I will pick that up with Martin's team, but it would be very helpful if residents could do that.
Okay, thanks for that. Please pick that up with Martin, and we'll make sure that that comes out. So, members, I see nothing else. I see no one itching to put in the AOB into the meeting. So I call this meeting to halt. And for those of you I won't see, have a happy Christmas. Gordon, over to you to close.